Leprosy, or Hansen's disease, as it's also known and named by a significant number of persons affected by the disease worldwide, is still a relevant and pressing health and human rights problem that impacts millions around the world, with more than 200,000 individuals being diagnosed with leprosy every year and an estimated 5 million living with its consequences. People living in poverty and the most marginalized groups are more commonly affected by leprosy, making persons affected by leprosy even more vulnerable than the general population to the worst impact of global crisis. Persons affected by leprosy are being especially harmed by the current global health crisis, the COVID-19 pandemic. I, Alice Cruz, the Special Rapporteur on the elimination of discrimination against persons affected by leprosy and their family members, have released a letter to the UN member states that contains 5 key principles that should guide responses to the consequences of the crisis in the medium and long term, and along with the Global Partnership for Zero Leprosy, released a report written from conversations with persons affected all over the world, identifying and giving voice to the particular needs and challenges of persons affected during this crisis. In our conversations, persons affected by leprosy identified key challenges and needs that should be addressed at this time.
Persons affected have healthcare needs that have not been addressed during the current global health crisis. Some persons affected cannot reach medical care because of transportation bans, which prevent them from reaching hospitals and clinics. Others cannot reach health facilities because public transportation is not operating. Women affected face even great difficulty in reaching medical care because of structural economic disadvantages and depends on third-party authorization for travel. If a person affected is able to reach a hospital, it may not offer the care they need. Some hospitals and clinics are only treating COVID-19 patients. Multi-drug therapy to treat Hansen's disease is largely still available, but drugs and medical care for highly complex Hansen's disease related health problems are unobtainable for many persons affected, which causes a severe deterioration of the health and great suffering. The continuum of care for persons affected by Hansen's disease is seriously threatening and may see a setback in their interruption of transmission and early diagnosis in the near future.
Persons affected by leprosy are unable to find basic goods right now, especially food, fuel for cooking, as well as clean water and soap, which are crucial to preventing COVID-19. Such difficulties are a result of systematic discrimination against this group. Persons affected by leprosy are structurally excluded from the formal labor market, which keeps them from secure income. This situation, together with the loss of safety nets and the shutdowns and travel bans and other exceptional measures enacted by the states, has determined the many persons affected by leprosy and their families are left to extreme poverty. Many communities of persons affected did not have access to clean water even before the pandemic, a pre-existing issue that has left them even more vulnerable to infection now.
Some people affected by leprosy, otherwise known as Hansen disease, have reported that their countries are offering food aids, social and income support to the poor, but often this support is not reaching people affected by Hansen's disease. Many are unable to receive this support because of structural barriers like eligibility criteria, not having the right kind of identification card, transportation challenges, or not having the information needed to register for an assistance, compounded by the inaccessibility of administrative services or bureaucratic procedures to illiterates or poorly educated populations, as well as those living in a remote area. In these countries, it is still unclear who is receiving what and difficult to ensuring that everyone's needs are being met. Current social protections are not adequately addressing this humanitarian crisis generated by the COVID-19 pandemic, which is disproportionately impacting the right to life among people affected by Hansen disease. It is time for us to do something.
The current crisis is disproportionately impacting particular groups within the population of persons affected by leprosy, including women, refugees, persons with disabilities, people living in remote areas, and children. These groups are of great concern. Cases of increased of disabilities among children affected due to delay of diagnosis have already been reported.
The elderly living in the farmer colony are now at high risk during this COVID-19 than the entire population of leprosy in the old, because their lives are always inadequate. There are still up to 2000 leprosy colonies and villages in the old today, and there is concern about settlements. First is institutional neglect leading to lack of food, clean water, sanitation, and protective items. Second is public administration, which has turned some area of this farmer colony into hospital COVID-19 patients. The use of COVID-19 area hospital as colony of leprosy has put the elderly person affected by Hansen disease at high risk at home.
Information about preventing COVID-19 is reaching some person affected by leprosy, but many other people affected are difficult to reach with information about the pandemic. This is because of many reasons like travel restrictions, geography, dark media area, or illiteracy. Organization of person affected and NGOs are finding alternative and innovative ways to get messages to those who need them, but more needs to be done.
These needs and challenges faced by persons affected by leprosy during the COVID-19 crisis must be addressed by NGO and government leaders. Leaders should fill the gaps and increase relief efforts for persons affected by leprosy worldwide. NGOs and governments should work together to ensure no persons affected are being left behind. Humanitarian aid should link relief to development. Unconditional cash transfers should link social protection to the promotion of active citizenship through training opportunities and formal employment. Organizations of persons affected by leprosy are leading relief efforts for other persons affected all over the world. Governments and NGOs should partner with and financially support these grassroots organizations and ensure the participation of persons affected in the planning and carrying out of needed relief efforts, which should integrate a gender-sensitive approach. Leaders should work to increase access to health care for persons affected. This includes working with national leprosy programs to ensure the right to a continuum of medical and psychosocial care that encompasses the full spectrum of prevention, timely access to multi-drug therapy, proper management of leprosy reactions, complementary care such as wound care, physiotherapy, rehabilitation, reconstructive surgery, alongside service delivery at the community level. Barriers to reaching healthcare, like transportation barriers, discrimination at health services, gender-based discrimination, and hospital and clinic closures to persons affected also need to be addressed. In all of these recommendations, leaders should work to elevate the voices of persons affected and use an intersectional perspective that addresses the other vulnerabilities persons affected by leprosy face. The COVID-19 pandemic is a serious threat to us all, but especially to persons affected by leprosy. What the world is living now is part, and only a part, of what persons affected and their families have been experiencing for too long, encompassing the multiple consequences of stigmatization, the impact of isolation measures on issues as varied as mental health, economic autonomy, independent living, or gender-based violence. And yet, persons affected and their families are currently among those bearing the brunt of the disproportionate impact of the COVID-19 pandemic. Governments and NGO leaders need to work harder to fulfill their obligations and duly protect persons affected and their families within a rights-based response that respects their rights to dignity, autonomy, and participation.